My name is Michael Sutherland. I'm the admissions tutor here at Corpus Christi College. I'm not a medic, I'm a physicist, but I get involved in admissions decisions for all subjects. This talk is just going to be a fairly brief one because I want to leave lots of time for questions. We're going to talk a little bit about what the university offers you as a potential undergraduate, and then take you through the application process. And I'll pause a few times to give you tips on how you might make your application more competitive. At the end, we'll be joined by Alexis, who I think you saw earlier, and Betty Chung, who's our next speaker, to answer any questions you might have about applying for medicine at Cambridge. So let's begin maybe just by talking about the university itself. So the University of Cambridge, obviously a very old institution. It's been around since 1209, one of the oldest universities in the world. And it is consistently ranked among the top. So students come from all across the UK and indeed internationally to study here. We are a very diverse university in terms of our intake, but also in terms of our intellectual offerings. So we offer around 30 courses, but within these courses, there's lots of opportunity for you to customize what papers you take and to kind of tailor the learning to your interests. On average, we admit around 3,500 students per year. That's across all of the subjects at the undergraduate level. And we are organized in what's called a collegiate university sense. And we share this kind of unusual structure with Oxford University. So what is a collegiate university and what does it mean for you as a potential applicant? So the university is organized into faculties and departments. And this is where the research takes place. This is where a lot of the lectures and practical laboratories take place. But in addition to faculties and departments, we also have 31 colleges that are part of the collegiate university. And the college is kind of your home away from home. So it's where you socialize, often where you live for the duration of your degree. It's where you get involved with things like extracurricular activities and where you get some of your teaching. So especially in the first and second years of many of our degree courses, a lot of the teaching takes place inside the colleges in the form of supervisions. And these are very small group teaching sessions, often with, say, 1, 2, or 3 students led by a researcher in the field. And that's a really fantastic way of learning about your subject. Colleges provide, I think, a really incredible amount of support. So we provide that academic support through our supervision system, the chance for you to identify perhaps areas that you don't understand and to get direct feedback and help on understanding them. We provide excellent welfare support. So the colleges will provide you with somebody called a tutor whose responsibility is to look after your well-being and offer that kind of pastoral help. And colleges can often offer financial support. So in the form of bursaries or hardship funds if you need help with the cost of living. Now, when you apply to the university, unusually you choose one of the colleges to apply to. So you don't apply to medicine at Cambridge University. You choose one of the 29 colleges that admits undergraduates and make an application to that college. And it's the college then that assesses your application. Now, sometimes students really worry a lot about this. Should I choose, Corpus versus Keys versus Homerton, say? I think probably in my experience, students worry a little bit too much about this. No matter which college you're at, you get a University of Cambridge degree, you take your lectures together, you take all of your practical classes together. You will make friends at different colleges and socialize amongst the various colleges. So in that sense, the college choice doesn't matter too much. However, the colleges do differ in terms of their size and location. Some are very old and traditional looking, like Corpus. We have these beautiful old buildings. You can see a picture of our new court there. Some are very large. Some colleges will have somewhere around 1,000 students, but some are very small. Corpus is one of the smaller colleges. And some are very central, and that has a lot of advantages. It's very convenient to get to lectures, but the center of town is quite hectic, and there are sometimes a lot of tourists around. So, you can start to make up your mind about what sort of college you would feel most comfortable in by thinking about some of these questions, and then visiting a college either on an open day or just having a look at their webpage and taking a virtual tour. But the bottom line is I wouldn't worry too much about the college choice. We have many more similarities than we have differences. But having said that, you're here at a Corpus Christi event, so let me just tell you a little bit about our college and the sorts of things that I think make it a very special place to study. Corpus is one of the oldest colleges in Cambridge, founded in 1352. We are on the smaller side, so we admit somewhere around 94, 95 undergraduate students per year. And we are very centrally located. So we're located 2 or 3 minutes away from some of the first year lecture halls. Just down the road from Fitzbilly's, which has amazing cakes, which I often enjoy. And that's very attractive to our applicants. Because of its small size, I think we're particularly close-knit. We have a very, undergraduate community that knows each other and supports each other very, very well. Medicine at Corpus, well, you're hearing from 2 of our fellows today. You've met Alexis, you'll meet Betty shortly. We've got a number of other very distinguished medics who provide a lot of the teaching support for us. We've got Professor Chris Howe, whose interests are on photosynthesis and the biochemistry that underpins it. We've got Professor Ewan St. John Smith, who works on pain in naked mole rats. So these are very interesting creatures if you ever see a picture of them. We've got Sam Bajati. He's one of our clinical fellows. He's an oncologist who combines clinical work with research on childhood cancer. And we've just had a new fellow join us, Nirupa Desai. She is interested in some of the mechanisms that cause cancer, and she's also works in the field of pediatric oncology. So a good number of fellows here to support you and do teaching at Corpus. One thing sometimes people misunderstand about Corpus is being a smaller college makes it harder to get into. Actually, we are a smaller college, but we receive far fewer applicants than many of the big colleges. So in terms of the number of applicants per space, we're somewhere around the university average. So don't let the small size put you off in that sense. Okay, let's switch gears a little bit and talk about the application process. These are the sorts of stages that an applicant needs to go through. And I'm just going to take you through these very, very briefly, and I'll pause at a few places to give you specific advice. So the first thing that you need to do is to choose your course. And this is probably exactly what you're thinking about right now. I would encourage you, if you're thinking of medicine, to also think about applying to a science degree, something like biological natural sciences. Try to assess whether your interests really lie on working in the medical field, working with sick patients, or whether you're much more excited by the science itself. If the answer is the science you really care about, you might want to consider applying to a biology degree. But have those conversations with your teachers, with your friends, and decide on your interests. Then the next thing that people need to think about is choosing the college. I've said a little bit about that, or you can do what's called an open application. And then you want to think a little bit about admissions tests or admissions assessments. For those of you applying for medicine, we ask all candidates to write the BMAT assessment. And that's something that's quite important as part of the application process. The UCAS deadline for applicants to Cambridge is mid-October, so that's earlier than some universities. If you apply to Cambridge, you'll be sent a link to fill out an additional application form known as the My Cambridge application. That just asks for a little bit more information, the sorts of subjects you've been learning about, a little bit about class sizes, and there's a box there to put in a supplementary personal statement if you wish. The next sort of phase is submitting written work, which generally for science courses like medicine, you're not asked to do, and take the admissions assessment. So most of the BMAT assessments, those are sat end of October or early November. And then we decide, based on all the information at hand, which candidates we will call through to interview. And the interview takes place often first 2 weeks of December, with decisions being mailed out to students usually around mid to late January. So that just gives you a kind of information about the flow of the application process. Now, just say a little bit about the structure of the course. I think Alexis has probably covered this to some extent in his talk, but just to make you aware that the structure of the course in Cambridge is perhaps a little bit different than medical courses at other universities. You do 3 years of preclinical studies in Cambridge, where you're essentially doing an applied science degree, and then you specialize in sort of the clinical side of things in your final 3 years. So most of your work in the first 3 years is in laboratory, lecture hall supervisions, and then you really get embedded with the clinical side of stuff in the final 3 years. Okay, now let me just pick up on a few elements in that application process that I think are particularly important and that I want to emphasize. One of them is this business about admissions tests or assessments. As I mentioned, medics have to sit the BMAT, the Biomedical Aptitude Test. This is used by some other universities as well. Mostly this focuses on scientific content that you would have learned in your GCSEs. So the GCSE biology, physics, maths, chemistry, that sort of content comes up. The questions themselves aren't particularly in depth, but you have to go through an awful lot of them in a short period of time. So you've got about 1.5 minutes to answer a series of multiple choice questions. And it's really important that you do reasonably well on this, because this is often something we look very closely at when we make our decisions about who to call through to interview. So essentially, you're demonstrating to us that you've really mastered that GCSE level scientific content. So make sure you prepare for these things. Don't sort of leave it till the week before. Start your revision maybe in September if you've got a spare moment. Use past papers as a guide to time pressure, so you can try doing some of them under time conditions. And there are many, many past papers, all available for free, often with answers accessible online for you. So I think there's a link there that we've put on our slide, but if you just Google BMAT past papers, it will take you there. So the next thing I wanted to mention a little bit about is the admissions interview, because I know some people get quite concerned about the structure of that interview. And I just want to emphasize that the interviews are not the final hurdle in our decision-making process. So we use them alongside all the other information we have, you know, your BMAT scores, your predicted grades, your GCSE achievement, personal statement, etc. And we try and build up a picture of an individual candidate's strengths and weaknesses. So it's possible that one of the interviews doesn't go particularly well, but other aspects of your application are very strong, and that you would still be a competitive applicant for an offer. So we use this information in a kind of holistic way and not as the final hurdle to getting an offer. So what are interviews like? Well, they're designed really around our small group teaching sessions, and it's allowing us to assess if that mode of teaching is a good fit for you and your way of learning. So the interviews tend to be done in pairs, often about 25 minutes in length, and they'll focus on scientific topics related to, say, GCSEs or your A-level science courses. And then sometimes for medicine, you might get some broader questions on medical ethics, and some discussions about what it means to be a clinical doctor. And so trying to assess your sort of clinical suitability for practicing medicine. The interviews tend to stretch and challenge you, so they're not just about factual recall. They're often designed in a way to really allow you to apply your knowledge to unseen situations. So you might be given problems that you can tackle using the tools you've learned as part of your A-level sciences, but it's something off the syllabus. And what we want to do is kind of teach you through it, give you tips and advice, see how you take on board new information, how you think on your feet, and whether we can work with you towards a solution. So it's very much, as I said, based on our supervision system here in Cambridge. There are some really great resources available to help you prepare. There are mock interview videos in medicine produced by the university, by faculties and departments within the university, and by some of the individual colleges. Colleges often will run admissions workshops that focus on interviews as well. So to get a good sense of the style of the interview and how it's conducted and what comes up, I really would encourage you to have a look at some of these resources. Less helpful, I'm afraid, TikTok and YouTube. Sometimes you get people talking about their interview experience. I've watched a good number of these. Sometimes they're okay, but sometimes they I think kind of make stuff up, and they're not as reliable as the resources provided by the institutions. Okay, so now let's shift to talking about what might make your application stand out, and what is it that we look for in a very strong applicant. So first thing to mention, it is a competitive process. So we had around 20,000 applications across the university for about 3,500 offers. That's in all subjects last round. In medicine, it's not surprising perhaps to learn that this is one of our most competitive courses. So we might get around 7 or even 8 applicants per place for medicine. So just keep in mind that this is a competition. The admissions process is designed to help us select those students who have an enthusiasm for the course, have a motivation for the course, but very importantly, have that clear academic potential to thrive in our system. One thing to mention, I think that's quite important for all applicants to realize, is that we do contextualize every application. And by that, I mean, we want to understand your individual educational background and assess your achievements within the context of that background. So for an example, I might have an applicant applying for medicine who's got 5 GCSEs at 8 or 9. And if they came from a school where they're the first person in that school to achieve that, or the top performer in their school, that would be very impressive. If they came to us from a school where the average person is getting 6 or 7 GCSEs at 8 or 9, that would be less impressive. So we want to understand your individual achievements within the context of your schooling. Okay, one of the things that I should emphasize when thinking about applying to Cambridge, we do look very favorably on students who have demonstrated engagement with the subject outside of your A-level or IB or Scottish Higher syllabus. So that we call this super curricular study, and it really is important in our application process. So we're looking for that evidence of academic engagement and independent exploration. Why do we do that? Well, because our students in Cambridge need to be quite motivated. And we find that students who have spent part of year 12 and 13 reading about their subject on their own time are the sorts of students that are going to come here and learn independently very, very well. So you can think of this supercurricular engagement as the backbone of your application for really any competitive university, not just Oxford and Cambridge. How should you use your time around supercurricular engagement? So I think it's quite useful over the months ahead. If you're thinking of applying in October, have a plan of what you want to explore and what resources you're going to use. And this should be a bit flexible. So you might decide that you're really interested in the genetics of cancer, and you decide to do some reading on that. And then maybe it doesn't interest you so much and you get more interested in kind of the clinical treatment of cancer. So you shift your focus a little bit there. That's fine. This exploration is very much a dynamic process. So be a bit flexible. I find it very helpful for students to keep a workbook of the things that they've read, the lectures they've attended, the podcasts they've listened to. Just jot down a few notes. What interested you about this? What are your thoughts? When it comes to writing that personal statement in September, you're going to be very grateful if you've got a detailed workbook with all of these things listed. Don't force yourself to finish something. As I said, if you're not finding a resource particularly useful or interesting, just move on to something else. There's so much available out there for you to read. I like to advise students to do a little bit at a time. So again, don't wait until 2 weeks before your school wants your personal statement done to say, well, I better pick up some books and start reading. Try to view it as doing just like practicing an instrument. If you do a little bit each day, you make steady and slow progress. So try to set aside half an hour a day, or equally a couple hours a week on a Sunday maybe, just to spend some time doing this kind of exploration. Now, I'll give you some specific examples for what we think of as supercurriculars in medicine. Congratulations, you're in one right now. This is very much a supercurricular activity, and it's designed to give you some insight into some of the exciting research that's going on in Cambridge. And it's definitely taking you beyond, I hope, your syllabus. So these sorts of online lectures are very much what we would consider supercurricular activities. You might want to consider also competitions. Newnham College, for instance, runs a medicine essay prize. Cambridge runs a chemistry challenge. There's the biology Olympiad, et cetera, et cetera. So some of you might be interested in these sorts of things, and they're a very good way to spend your spare time. There are lots of free online resources out there. Physiological Society, Institute of Biomedical Science is another one that have information on the latest developments in medicine. Likewise, journals, British Medical Journal, The Lancet, some of these articles will be free for you to read. Some books which can be of interest to you. There are many in medicine. I've listed a couple there, but by all means, explore your library and see if there are some other interesting books about medicine that capture your own personal interests. Practical experience, I think, is very important for a medicine application, and it's really any work experience in the healthcare profession. So it doesn't have to be, shadowing a surgeon or something. You can go work in a care home. You can go and shadow your local GP. You can work in a medical imaging setting as well. Really, wherever you can find practical experience, that is welcome. We want you to just get an experience of what being a practicing medic is like. And again, with any of these things that you're doing, keep a journal, take notes. What are you learning? What are you finding interesting? We want to see evidence that you're not just doing these things, but really engaging with them. Okay, so a few sort of general thoughts around supercurriculars and medicine. So here are some examples of topics or areas that might capture some of your interests. You might want to think about things like lectures through a program we have here in Cambridge called HE+. This is a series of online resources available for students who are interested in particular subjects. You might do a workshop organized by the RSC on various medical techniques. You might read something about T cells and the immune system in the International Journal of Molecular Medicine, and you might do a shadowing virtual experience. So these are things just to give you some specific examples of what we're looking for. It can help sometimes if you identify themes that interest you. So cancer treatment and research, we've talked a little bit about. Complex surgical procedures might be something that you're interested in. And indeed, Alexis, that you've heard from, is a world expert on these and has appeared a number of times on television to talk about some of the surgery that he does out at Addenbrooke's Hospital. And then you might have a list of things that you want to know more about. So maybe you heard a little bit in a lecture about genomics, and you're curious to learn a little bit more. One of last year's speakers, Dr. Bajati, has a great online lecture on this that you can go and have a look at. So think of it as it's kind of a continual process of moving through, trying different things, thinking about things that you want to look at, and keeping that sort of steady and slow progress all the way through from now right through to your university application. And hopefully for most of you, it'll be interesting. It won't be hard work at all, because this is really fascinating stuff. Okay, I'm just going to end now, and I'll leave us lots of time for questions. I wanted to remind you of some important dates for your calendar. Cambridge University is running open days on July 6th and 7th. It will be possible, pardon me, to come and visit the university, to see some of the departments for yourself, but importantly also to come and have a look at the colleges. So do drop by Corpus Christi College and say hello to us. Oxford are running a similar series of open days a little bit earlier in the calendar. So do take the opportunity to visit.
Great, thank you very much, Michael. We've got just over 15 minutes now for some questions. So a few questions that have kind of been coming out already, some themes and questions. A few people have been asking, is virtual work experience valued as much as in-person work experience? You did mention virtual work experience just at the end there.
Yeah, I mean, absolutely. We view it as identical, and we know not everybody has the opportunity to get in-person work experience. That's absolutely fine. If the virtual placement is what you can find in your local community, by all means do that.
Great, thank you.
More importantly is what you learn from it, what observations you take away.
And that probably leads on to another question. A lot of people are asking, like, how do you write about this in your personal statement? How do you write about work experience or supercurricular in your personal statement? You know, you're not presenting a research paper on what you've done, what you've learned. Yeah. How does that translate?
Yeah, I think that's a great question. And sometimes I think, you know, our medical applicants are always very motivated. They're doing lots of things, but I read personal statements and it's a bit like a shopping list. Like, I did these 3 lectures, I read these 6 journal articles, I did this, and this, but I didn't really get a sense of the person's individual interest in that area. So try to narrow it down to a few of these experiences that you've done, a few of these supercurricular activities, and talk about what you got out of it. So for instance, you know, you might go and volunteer at a care home, and you might observe the way that nurses deal with people with dementia. And you might have some interesting observations about that. So that kind of keen observation and thought on that particular experience is much more valuable to me than a shopping list of, you know, the 24 things that this person has done.
Thank you. Thinking about shopping lists of supercurriculars, how do you know when you've done enough supercurriculars? Is there a case that you've done enough?
I mean, it's an interesting question. I don't think our students ever stop doing supercurriculars. I mean, it's part of a sounds a bit weird, but it's part of a lifestyle. You know, if you are the sort of person who's super curious about medicine, you're going to be reading and doing these things really all the time. So I don't want you to think it's just, right, I've got to do 4 supercurriculars and then I'm done, and then I apply for medicine. I want you to get into the mindset of, I need to be engaging with this topic, you know, on a weekly or daily basis, all the way through to the university application and beyond. If you come here as a student in medicine, you're going to be thinking about medicine, you know, for the next 6 years and beyond. So I don't think there's really a cutoff.
Yeah, I'd agree. Thank you. I'm going to move on to some of the sort of more technicalities of the admissions process here. What's our international intake for medicine, and is it harder to get in as an international student?
Yes, yes. Frankly, it's very challenging to get in as an international student. In all other subjects except for medicine, we just admit the strongest candidates. We don't have particular targets. For medicine, we are only allowed to admit 25 international medics across the whole university each year. And this is set for us by the government. They have certain targets on the number of doctors we have to train to keep the NHS going. So we have no flexibility in that. And needless to say, those 25 places are very highly oversubscribed. Not to say it's impossible. I mean, we met 25 every year, but do just keep in mind that these are highly sought after places.
Thank you. What importance do you place on GCSEs? Can you get in if you've not got a host of A-stars at GCSEs, and how do we contextualize those?
Yeah, that's a good question. So, I mean, we look at GCSEs. Look, they're important for us, but we tend to, I would say, pay a bit more attention to GCSEs in science subjects for medical applicants. So, you know, we're hoping that you're getting strong marks in biology, in you know, physics, in mathematics. If you get a 6 in GCSE French, I mean, okay, it's, you know, not great, but you know, it doesn't necessarily influence your potential to be a stellar academic. But I would say, getting back to something that I talked about earlier, they are just one part of the admissions decision-making process. So if your GCSEs are a little bit, perhaps lower than average, but you've got those great teacher references, the strong BMAT scores, and you do really well in the interviews, then you'll probably get in. So, don't view that necessarily as a barrier, but try to make sure other aspects of your application are strong.
Thank you. And along the same vein, what's the significance of the BMAT score? How much does it matter that you do well in the BMAT?
Yeah, so just like the GCSEs I was talking about, we contextualize BMAT scores. So we would look at the average BMAT score of applicants applying from schools like yours with similar levels of academic achievement. We would hope that those students who are getting a lot of academic support from their school are performing, frankly, a little bit higher on the BMAT than those who are not. Again, it's not the only thing that we use. It's possible to have a slightly lower BMAT score, but if other aspects of your application are very strong, you can still be competitive. But I would say, given that most of the people who apply for medicine are predicted 3A stars, most of them have done well at GCSE, most of them are doing supercurricular activities, you are in a very competitive field. And if the stronger your BMAT score is, frankly, the more it's going to help your application. So take these things seriously.
Thank you. So the technical application side of things. So does applying to one college make it more likely that you'll get in than another?
Yeah, that's a good question. So in Cambridge, we run something called the winter pool. And what this is a mechanism to redistribute applicants to colleges that perhaps didn't receive that many strong applicants in that particular year. So it's possible, for instance, that you could apply to Corpus. We had a really strong year. We only admit, say, 6 or 7 medics each year. So we take the very strong applications and allow other colleges to see them through the winter pool. And you might end up at a college across the road, say St. Catherine's. And that system very much works in your advantage as an applicant to make sure that if you are strong, you have a fair chance of being seen by all of the colleges. So in short answer to your question, college choice doesn't really affect your chance of getting an offer in Cambridge. However, be aware that some colleges are more popular than others. So if you apply to a very popular college, you have a higher chance at being put in the pool and ending up at a less popular college.
Thank you. I can see that we've got Alexis and Betty have joined us now. So probably all questions could be answered by any 3 of you now. This is one I think could be answered by any of you. Is there anything that you don't want to see in an application? Anything that kind of looks like a red flag to you?
I've done all the talking. I don't know if Betty or Alexis want to jump in on that one.
Well, I mean, you're applying in a course that you're going to become, ultimately a doctor. So I think a lot of the red flags would be self-evident. So other than that, but it's more important, I would say, that, putting that aside, the other thing is, if we are not convinced and what you say in the application is truly genuine. I think the most important thing I would say in the application is that it's better for it to be a bit less polished and be genuine, but who you really are, what you really want to do, rather than putting a lot of things that look very good. But then when we have a chat, we look at everything as a mismatch because what you write down and what you've actually done and want to do. So I think that would be my main advice based on that.
Thank you. Anything that either of the 2 of you want to add? Agree with that?
Yeah, I think that's good advice. Presumably, make sure you don't faint at the sight of blood.
But I fully agree about honesty as well, because I have seen many applications where the writing does not correspond to some of the answers that's addressed in person.
Yeah, great, thank you. Somebody's asked, in the interview, is it best to talk formally, or should you be more casual and talkative when you're explaining your ideas in the interview?
I think professional is a better word than formal, in that, it's a preparation for, potentially the next 20, 30, 40 years of your life. So as a doctor, you do need to act like a professional. So it's not about being formal, it's not about being casual, it's about being approachable and genuine and heartwarming, but at the same time being professional about it. So again, it's something that, we don't expect you to get absolutely right from day one, but equally, we had some people say, rock up and say, oh, hi guys. So that might not be the best way to start off your interview.
Going back to a question that we got earlier on, which I think is probably one for Alexis or Betty. Do students coming out of Cambridge medicine feel less prepared as junior doctors because they've not gone straight into clinical studies at the start?
Well, it depends which way you want to look at that. So certainly, if you look at the metric when you're a fourth year and you've just started your clinicals, then yes, you're a bit behind. But then again, if you look at the outcomes of how people do in their specialty exams, which involve both clinical and written components, in fact, a lot of the Cambridge and Oxford graduates do a lot better. So it's difficult to pick out whether it's because of selection bias or the course or a combination. But all I would say is that a lot of Cambridge graduates do end up getting a lot of very competitive posts and, leave the metrics to speak for themselves.
Thank you.
Can I just make a small amendment to that? So many medical students also take a break from their clinical studies and divert to research. And this is actually quite a common phenomena in Cambridge and Oxford. So the research is not completely irrelevant, but they are often, for example, things like doing a PhD that can also enhance their medical practice as well.
Thank you. Another one for Betty and Alexis. Would you say, what would you say makes a doctor different from other healthcare professionals?
It takes a lot longer to train, for one. Well, as a doctor, a lot of things, when you look at how medicine is structured and delivered, even if you work with a lot of other health professions, ultimately, a lot of the time it's the doctor who has the ultimate responsibility, even if they are working within a broader team. So when it comes to changing practice and deciding what to do and how to push the field forward, at some point you do need to have somebody who's medically qualified. So whilst it does take longer, it's so that you have both the knowledge as well as the practical experience to be able to take the field further. And that's slightly different from a purely vocational focus like most other allied healthcare professions.
Thank you. Next question is, what's different about graduate entry medicine to undergraduate entry medicine?
Well, one is you need to have a degree, but the second one is it's a bit shorter, it's a bit more intense. And as in, if you are somebody who's graduating and thinking about whether to do the undergraduate course or the graduate level course, I think there are some differences in the way it's delivered that may appeal to some people. One might appeal to some people over some people to the other. At the end of the day, it's a year shorter, the grad entry. You have less holidays, but you still end up being a doctor at the end, whichever way you take.
Thank you. How in depth do the those who are conducting interviews expect applicants' medical knowledge to be? Let's take that one.
It depends. So the interviews are very flexible to adapt to your own level of knowledge. And going to my first answer, if you said you've done an extended essay on topic X, then we might expect more than asking you a question completely out of the blue on the same topic. So again, we will always go into more depth to see how much you do know on things that you've covered or you've said you've covered. But yes, we don't have any fixed criteria. It's just seeing how what you know on the things that you've covered at your level of knowledge. So a lot of the interview is about applying your existing level of knowledge to, for example, a new situation, without necessarily worrying too much about the detail.
Still on the interview, a few people have asked, does it matter what you wear to the interview?
Michael, I believe they're online this year, aren't they?
Yeah, I can take that one. So they have been online for the past 3 cycles because of COVID. We are currently in the process of making a decision what format we're going to have moving forward. So they could be online, they could be in person, it could be a mix of both, and we'll communicate that, I believe, in May to schools and applicants. But you know, my advice, just wear something that you feel comfortable in. But you know, as Alexis says, there is a certain professional aspect of these things. You're interviewing, you know, perhaps for a degree which is going to lead you to a certain career. So, you know, so ripped jeans and a tank top, you know, maybe not so appropriate. Also, if it's December, that's gonna be pretty cold. So I would just say, you know, whatever you're comfortable in within reason.
And equally, don't come in a three-piece suit feeling really uncomfortable in the interview as well. Just, you know, something that would, you know, be appropriate.
Yeah. What's your view on taking a gap year, applying for deferred entry, or can you, to tie in another question, can you, once you've been made an offer, then ask to defer your entry?
Do you want to take the second bit, Michael?
It's possible, but I mean, I would tend to only grant deferred entry if there's a very good reason, because you know we have 6 or 7 places we can offer. If lots of students start applying and then saying, oh well, actually I'd quite like to have a gap year and backpack around Europe or something, that makes it very difficult to manage numbers, and you know might cost somebody a place who would have been admitted that round. So I tend to only allow applicants to defer after they've applied if they have a very good, say, a medical reason or some other particular reason. But as a general principle, I try to discourage that. It's okay if you want to do a gap year, fine, by all means do it, but apply for entry when you're done that gap year. That would be my advice. But Alexis, maybe you have a different view.
I mean, I must say that when we assess your interview, we look at purely, you know, how good you are, your potential, all the other things. If you said from the outset you want to gap year, I wouldn't say that in itself counts against you. I think where it gets more complicated, as Michael was saying, if you get the, well, actually, I want to change to gap year, that does become more complicated. But as with everything, we have to look at you as an individual and how this all fits. And equally, I wouldn't say, oh, I'm going to do a gap year because, oh, it'll help my chances, or I won't do it because it's not going to have my chances in it. You need to, one particular thing about the medical training trajectory is you can't always defer doing what you want to do until you finish, because it never finishes. It's always a journey. So if you really want to do a gap year for your own personal reasons, you should do it. You should never defer all these things, because the same with undergraduate, postgraduate, specialist training. You know, medicine and medical training needs to go alongside your own personal life. So, and that's a choice you have to make. Don't always have to, you know, force shoehorn what you want to do around that. And that's important to have that balance throughout your learning.
Thank you. I think we've got time for probably just a couple more questions now. So next question, how useful is an EPQ on a medical topic? Would you expect an EPQ? Does it make any difference to your application at all?
Well, if you've mentioned it, then we're very likely to quiz you a bit more on that topic than, you know, if that topic was something that you didn't have an EPQ on, but we don't expect it for sure. It's, you know, your personal statement is something personal, and you choose the things that you want to highlight in it. And some people highlight their EPQs, some people highlight other things. So it's what you choose to highlight. Yeah.
If you're doing an EPQ, you'd need to disclose it on your UCAS form, but it's absolutely fine, I think, not to be doing an EPQ. Some do and some don't. And then, yeah, I think we'll make this the last question, because then we'll move on to Betty's talk. Biology is not a requirement for medicine at Cambridge, but how much is it kind of expected?
I mean, maybe Betty, do you have a view on this one?
I think it's, since you're going to be practicing medicine, it will be important to have an interest in biology, but that doesn't mean you should spend, you know, to do a biology Olympiad or study biology in high school, because ultimately you can learn biology some other places as well. So for example, for me, I am a biologist at the end of the day, and I didn't study biology in high school, but I know a great deal about biology from self-studying and various other things I did to reflect that.
And that's general good advice. There are certain subjects that are requirements for the subjects you apply for, but the other subjects are kind of recommended. If you're not studying them, there are lots of opportunities to study them independently, and you can pursue that. Brilliant. Thank you so much for everybody on the panel who's been answering questions. There were so many questions. We've got through as many as we can.